Hey everybody, this is Alex Merced from alexmerced.com, and what I want to talk about today is healthcare. Basically, the debate between Bernie Sanders and Ted Cruz just wrapped up, and first thing I want to say is, yes, more cowbell, but more cowbell shouldn't be more government. More cowbell should mean more free markets. But let's first break down the debate and what I thought of the debate, and then we'll talk about the actual issue of healthcare. Now, the debate was good. It kind of illustrated both sides. I was a little underwhelmed with Bernie Sanders, not necessarily because I disagree with him, which I do, but also he didn't necessarily support a lot of his arguments with as much facts as Ted Cruz. Ted Cruz definitely prepared for the debate. And I could anticipate what would be the counter arguments to many of Ted Cruz's points, which I'll point out later on. But Bernie Sanders basically relied on emotional appeal. So every time Ted Cruz pointed out a fact, Bernie Sanders just responded with how horrible it is if someone doesn't have this health care or someone's left in this situation, which is true. That's the point of the issue isn't that people don't want people to have health care. Oops, sorry about that. It's not that people don't want people having health care. It's not that people don't want access. It's the economics reality of the situation. And many of the people you saw in the audience were people who, yes, did benefit from the situation in which Obamacare was, but you also saw people who didn't benefit and who were worse off. And it's not that simple. With the Obamacare system, there are going to be people who benefit from it more than they would have if it wasn't in place. And there's going to be people who benefit less. There's going to be winners and losers. There is no particular solution where there aren't going to be winners and losers. Even in a free market solution, there are going to be winners and losers. And some of those losers may be people who would have been winners if Obamacare stays in place. And some of those winners might be people who would have been losers if Obamacare stays in place. So let's not deny that whatever the result is, there will be winners and losers. I do firmly believe, though, in a free market system, and I'll explain why, you'll have more winners than losers at the same time you're respecting people's individual rights to have control over their property. Okay? So, one of the issues I had with the debate overall is that, while I know the debate was focused on Obamacare, Ted Cruz staked a lot of his argument just on negative consequences from Obamacare since it was incepted, but also at the same time kind of defending what existed before Obamacare, which was bad as well. And Bernie Sanders, again, basically just kept kind of defending Obamacare as a step towards Medicare for all. I can't really do a good Bernie Sanders impression. So basically, bottom line is you had both sides, really, neither of them think that Obamacare is ideal or even close to ideal. So it's a weird debate to have Bernie Sanders, who doesn't believe Obamacare was the right solution, defending it, and Ted Cruz attacking, especially I think Rand Paul would have been better since he's an actual medical professional, but Ted Cruz was prepared sufficiently to excel in this debate, while there was a lot of points that he didn't make that I think he should have made. So now to the actual issue at hand. Bottom line is, too much of the focus is on healthcare insurance. Access to healthcare insurance is not the same thing as access to health care. Okay? Ted Cruz did make this case, and he did make an analogy. I don't know sure if it really connected or people really understood it, but he basically made the analogy of it's as if the government said everybody has bus tickets, but there's not enough buses for everyone to take around. Okay, so just now because you have access to a bus health care insurance, the equivalent of the bus ticket, doesn't necessarily mean you're going to actually get that care. Okay, and I think Ted Cruz relied too heavily on the argument of rationing and saying that government's going to ration care. And while he did back up that argument with statistics of countries around the world, the counter argument, sort of the point that progressives make in opposition, is the broader access to care, in the sense that more people can have care, and then also that they don't have to worry about that as a specific out-of-pocket expense. Okay, and this is where I think Bernie Sanders eventually, I was surprised he didn't make this point out of the get-go with the entrepreneur from Texas, who basically kept her payroll under 50 workers, because if she hit 50 workers, then she would have to give all her employees health care. And healthcare is expensive, okay, if for an employer to provide. So it would drastically hurt her profit margin to the point where she doesn't have a profit margin. Her profit margin is so slim, she can't afford healthcare for herself. Okay? At first, Bernie Sanders just basically said, you're on your own. I believe you should give your employees health care, which just showed a complete disregard for economics. There are a lot of business models. There's a lot of businesses where profit margins just aren't there. The profit margins are slim. Okay? And people say, and then whenever I hear or I make that argument, you always hear people say, well, if someone can't afford to pay their employees health care or pay their employees the minimum wage, then they shouldn't be in business. Well, some business models, some businesses out there are just slim margin businesses. That's just the way they are. Things like fast food, things like, in this case it was a beauty salon, stuff like that. You can make a living, but you're not necessarily going to become rich for the most part. There are some sort of high-end hair salons that can make a huge profit margin, but it's less than typical. But at least this lady in Texas, she had multiple salons employing many people in jobs that they may like. It's creative work, and sometimes the work that you're passionate about isn't the work is the most lucrative, and there's nothing wrong with that. But again, she could have been employing more people, which could give people the experience they need so that they can go work at those more higher-end salons that do have they do charge more per haircut or whatever. Okay, I'm not a haircut person either, or a haircut expert as Bernie and Ted Cruz aren't. But Bernie did eventually get to the point that under a Medicare for all system, she wouldn't have to worry about providing health care for herself. She wouldn't have to worry about providing health care for employees. But the problem with that is that the amount of taxes that would have to increase in order to afford that, which Ted Cruz made a great point about, in the sense that basically even if you did tax the 1% or all the wealthiest people 100%, it would not cover a fraction. Basically, he said 5 months of Bernie's plan. Point is, it costs money. Okay, that's why the Obamacare mandates certain care to be on all plans. So, for example, my plan covers all sorts of maternity care, covers birth control. I don't need birth control. My wife does, and her plan covers birth control too. But because my plan covers birth control, 60-year-olds who are past baby making are paying for birth control, then they can provide birth control cheaper or for free for everyone. They can provide maternity care for cheaper for free or on most plans. That's the or for free on most plans. Those specific things are generally free. They're automatically included on your healthcare plan because of the Obamacare mandates. But the way they pull that off by making a bunch of people who don't need those services pay for it. Okay? Okay, and then generally the argument for that is, well, your kids may need it. So that's, you're paying for it because, when you were young, you may have received the service or whatnot. That's the kind of logic there. And I'm not necessarily against that logic. The idea of I'm not against the idea of organized, the idea of single payer, the idea of people getting into a group and buying something as an organization. But I don't think government should be doing it. Okay? In a free market system, that can happen. You can have a single payer plan. You can have a plan to like what Bernie Sanders is advocating. Okay? And the thing is that it's not just about whether you have a single payer. It's also about how that single payer organization is run, the internal governance and whatnot. That's why you want it done in a market system. And this is part of actually Rand Paul's healthcare plan, to actually allow people to create entities for purchasing healthcare. This is something I've talked about in my own campaigns for office, where I talked about creating consumer unions, allowing individuals to form legal organizations like corporations that are tax exempt to do communal purchases for things that maybe be hard. Picture having in this case, people could create this organization, they become a member of it, has nothing to do with your employer, and then they can go out there and buy healthcare in bulk or provide healthcare to all of its members. This is essentially what health sharing networks do. Okay, and just to kind of illustrate a point, what a health sharing ministry is, it's not health insurance, but it's a health. It provides you health care that's exempt from Obamacare. Okay, claiming a religious exemption, that's kind of how they set that up. But the way it works is that you're not guaranteed acceptance into a health sharing ministry. You have to be health checked. I applied for a health sharing ministry. I didn't get in because at the time I wasn't healthy enough, which is fair. I mean, the expenses they would have paid for me would have been more than everybody else. But because of that, just to compare what I would have paid if I hadn't accepted, which again, the fact that they denied me was one of the best things ever, because it got me to get serious about my healthcare. I got a Fitbit. I have lost weight. I've been paying more attention to my healthcare because pricing signals in the market incentivize me to do so. It suddenly became an imperative for me to get my health in check. Now, of course, ideally I would have been taking those steps already just for the sake of my health. But again, some different incentives work better for different people, and market incentives do have an effect. But what happened is that their premium for me and my wife, with $1,000 deductible, would have been a little bit over $300. Okay, so for a little bit over $300 a month, that would have covered me and my wife with $1,000 deductible. So we'd only have to pay out of pocket for the first $1,000 expenses for the entire year, and then everything else would be covered by the health sharing ministry with certain caps. So basically, there is a point where if we spend like $1 million in healthcare, then after that they don't cover anything beyond that unless in certain circumstances. Again, they decide the elector of their plan, but that's pretty affordable. Instead, on Oscar, which I don't have anything negative to say about the company itself, but because of all the different mandates and the care they have to provide, and the way it's got to be provided, and the bureaucracy and the cost of administration, with Bernie Sanders and Ted Cruz both talking about the amount of paperwork a doctor has to do. And again, yes, there is government paperwork and there is insurance paperwork. That's why at the end of the day, you want to get government out of between you and your doctor, and you want to get insurance out between you and your doctor, and we'll talk about that. But with Oscar, I'm paying a little over over $500 a month, a bit over $500 a month, just for me, with a $2,000 deductible, $4,000 max expenditure. So I'm spending $2,000. So basically, I have to pay the first $2,000 out of pocket, and I'm paying over $500 just for me. Well, before I could have paid a little over $300 for me and my wife with a $1,000 deductible, and then she's paying pretty much very close to what I'm paying separately. Okay, so basically, way over double we're paying, and we're actually getting less coverage in a sense. Well, technically, yes. There's like I'd be better off if I got the most horrible disease ever, and they spent millions and millions of dollars on my care. Generally, probably for the coverage I am going to use this year, I'm basically paying for nothing. Okay. For that, I could have paid for the checkup. I'll probably get out of the pocket, and I probably still could have paid for the endoscopy. I'll probably get later this year out of pocket, and still have more money in my pocket than if I had bought the health insurance. Okay. But again, you buy insurance because of a risk, and that's why ideally you wouldn't be buying insurance for your everyday expenses. Instead, you should be paying for your everyday expenses. There's a reason for that. Think about anything that you buy. When you go to a restaurant, restaurants have an incentive to kind of make the experience as pleasant as possible. And the experience is not just like how fast you get seated, how nice your waiter is to you, but also how good the food tastes. Everything about the experience provides value. Okay? And the reason they do that is because you can choose not to go to that restaurant. Okay, you can choose not to go to that restaurant, so they have every incentive to try to get you to keep choosing. That's the benefit of voluntary arrangements. But with healthcare, voluntarism is completely out the window. You have to go to the doctors that your health insurance company allows you to go to. Your in-network doctors, unless you have a really nice healthcare plan. And then you don't directly pay for that doctor. You may pay a copay, but they don't care about the copay. They care about what the insurance company pays. So how long you have to wait, how long all that, they don't really care, because what are you going to do? I mean, you could kind of go somewhere else, but there's not many other options. So in that case, you're just going to deal with it. They're more concerned with what your insurance company wants, because they're the one making the choice to pay. So they're more concerned on whether the paperwork was done right. They're more concerned about how, and then the thing is that insurance companies take their sweet time paying the doctors, so the doctors want to overbook, which is why you have to wait so long, so that way they have enough billing going out there, so that way there's enough cash coming in to be able to pay their bills. Because they may be billing $10,000 a day, but they may only be receiving $2,000 for that $10,000 they billed. Because this whole system is so untransparent, because it's not a market-based system. Okay? You are not choosing who your healthcare providers are. Your health insurance company is. And you don't even get to decide what your health insurance is most of the time, because your employer does. So health insurance companies don't design a product for you because you're not the one who makes a choice on whether to buy it or not. Your employer does. So they design the product to be convenient for the employer. How easy is it for their HR department to keep track of? What benefits are there for keeping track of the financial expenses and whatnot, taxes, all this stuff? That has nothing to do with the quality of care you're getting. So since you're not making any of these choices, no one's designing the product for you. So this isn't a market system. This isn't the market system where products are designed for a consumer because a consumer has a choice to purchase it or go somewhere else. Okay? Yeah. So in that case, you want, and then why does your employer choose? Because of World War II. In World War II, you had wage and price controls. So employers could not offer higher wages to employees to attract new employees because the government got involved and said, you can't. So the only way for employers to attract new employees or employees from somewhere else to get the talent they needed was to offer them other benefits. So things like our retirement, things like our healthcare became more and more tied to our employer because of a government intervention in World War II. Okay? So at the end of the day, and if you really want to understand the history of how we got to where we're at, I highly recommend the book The Primal Prescription by Robert Murphy and Doug McGuff. Okay? It's going to be better than any argument that Bernie Sanders makes. It's going to be better than any argument that Ted Cruz is going to make. You read that book, you will understand the issues regarding healthcare and the history that got us there. Because there's so many different mandates. I mean, they talked about the FDA, and it's true, the FDA process makes it harder for medicines to get here, and then companies have to spend so much money to get through that process that they have to recoup that money by charging way too much for these medicines. Okay? Also, you can take a look at intellectual property laws, where basically people have patents that last so long that allow companies to charge so much for so long because there will be a lack of a generic alternative. But again, you can't make that generic alternative available because then they're going to go broke because they didn't recoup their FDA fees. So if you can make the FDA process cheaper, then you can probably even reduce the intellectual property protections, and that will make the overall process cheaper. Okay, so prescription drugs. Yeah, so again, you can fix the prescription drugs by reforming the FDA process. And then again, to get to a consumer-oriented market, you have to shift the tax incentives. Because right now, all the tax incentives, and I mean, some of that did change with Obamacare, very little and not very effective. Because basically, to get tax incentives, you have to kind of go through the exchange, but the exchanges don't, basically, insurance companies are losing money by going to the exchanges. So in that case, you have no options when you go to the exchange because all the companies are like, we can't afford to keep doing this. So then you have no options. That doesn't quite work either. And then the government actually pledged to pay all the losses of the insurance companies. So every year when the insurance companies have a huge bunch of losses, it's the government that's footing the bill. It's your taxpayer dollars that are footing the bill. This doesn't work. Okay, there was elements that were scratching at good ideas, but then they added stuff that doesn't work to it. Okay? So yes, you want to shift those tax incentives that are on the employer to the individual. So individuals buy healthcare. But kind of like what Rand Paul's doing, give people the ability to get together, separate from their employer, to group purchase. Okay? So I forget what Rand Paul calls it, but again, I like to refer to these kind of things as consumer unions. In this case, these would be like healthcare purchasing unions, where basically you can start an entity, you guys buy prescription drugs in bulk, you guys buy... so instead of having to go, not even buy insurance, you'll just maybe pay for the care itself. Basically becomes like a pseudo-like insurance company, but not. Okay, and then maybe works with an insurance company to provide you catastrophic care. So you pay a membership fee into this organization, and that helps pay their administrative costs that maybe include catastrophic care, and then they'll help you get bargain for prescription drugs, bargain for all these other services. But again, then it's not tied to your employer. It's not tied, and then you don't have to worry as much about pre-existing conditions and all sorts of other things. Okay, so you can have that single payer system because you'll have all these different organizations that you can choose to become a member of that does the payment for all of that stuff like a single payer system would, but they're competing against other ones because you can choose which one you want. That puts a pressure on them to figure out how to administrate it as efficiently as possible, to how to provide value for you because you can choose whether to be a member of that organization or not. So they got to figure out how to give you the best value for your dollar. Okay, and then what you want is better healthcare. What you want is better coverage. This has nothing to do with your employer. It has nothing to do with the insurance company. So they're catering to you. So I really like Rand Paul's plan, by the way. They're catering to you. And over time, you know what? There's going to eventually be probably one or two of these organizations that prove to be the best. And if they can operate across the whole country, you'll pretty much end up with a single payer system over time. But at least the competitive process on the way there allows us to discover the best way to do it. Instead of the government just implementing one method of single payer, okay, that has no competition, that has no alternative. So basically, the issues with the bureaucratic process, the issue with the efficiency of how it's run, and all this stuff doesn't really get solved. And if it does, it gets solved at a snow crawl, because basically anything in government takes a long time because of the politics of it, because of the corruption of it, because somebody somewhere is making money on the other end of every inefficiency in government. Somebody's on the other side of that overspending. And they're going to advocate and lobby to prevent that overspending to be fixed. That's just the way it works. Okay, there's so much more I'd like to say, but again, I'm sure you guys are probably tired of listening to me at this point. But if you enjoyed what I have to say, please, again, go buy that book, The Primal Prescription. You can go to, if you go to LibertyDeal.info, there's a recommended reading list, and you can find a link to the book over there at LibertyDeal.info with the links to a lot of other great books I would highly recommend. Also, while you're there, pick up one of these neat t-shirts. Okay, make markets free again. And share this video with somebody who needs to hear this argument, and like my Facebook page, facebook.com/AlexMercedLP, so you can keep hearing commentary from me on all these different issues. And thank you so much for actually making it this far into the video, because I know this is a long video, but there's a lot to say on this issue. Thank you very much. Have a great day and enjoy. Thank you for enjoying a video by Alex Merced, bringing you principled, thoughtful, and accessible commentary on today's issues. Show your support by becoming a monthly patron at patreon.com/AlexMerced. There are special benefits depending on the level of your monthly gift. Find great deals on web hosting, podcast hosting, and more over there at LibertyDeal.info. Also check out Alex Merced's recommended reading list at books.alexmerced.com, and while you're there, pick up some other great stuff at Amazon.com. For other options for support, such as one-time PayPal donations and Bitcoin donations, go to support.alexmerced.com. Make sure to follow Alex Merced on these other social media platforms.